Have you ever felt a sudden change in your breast and wondered what it meant? It is a moment that can bring a mix of questions and concern. Understanding what to look for can help you feel more prepared and in control. When you find a breast lump, it is very important to note several key characteristics to share with your healthcare provider. These include its size, its shape, its texture, whether it moves freely or feels fixed, and if it causes any pain or discomfort. Also, observe any associated changes in the skin over the lump or in the nipple. These characteristics are vital because they can offer important clues about the lump's nature. For example, benign or non-cancerous, lumps like cysts or fibroadenomas often have distinct features. Cysts might feel soft and fluid-filled, while fibroadenomas are typically smooth, firm, and movable. In contrast, lumps that requiring closer investigation might feel hard, irregular in shape, or fixed to the surrounding tissue, and they may not cause pain. Your doctor uses these observations to guide their initial assessment and determine the most appropriate diagnostic steps. So, how can you effectively note these characteristics? When examining a lump, gently feel around it to determine its exact location and size. Pay attention to its borders and whether they are well defined or irregular. Try to move the lump with your fingers to see if it slides under the skin or if it feels deeply attached. Also, consider when you first noticed the lump and if it has changed in size or feel over time, especially in relation to your menstrual cycle. It is important to avoid self-diagnosing and instead focus on gathering clear information to share with your doctor. Medical professionals refer to a comprehensive evaluation as a triple assessment, which includes a clinical breast examination, imaging like a mammogram or ultrasound, and sometimes a biopsy. Your detailed description of the lump's characteristics during the clinical breast examination helps your doctor decide which imaging tests are most appropriate and whether a biopsy is needed. For instance, a lump that feels rubbery and moves easily, often called a fibroadenoma, might be monitored with imaging, while a hard, fixed, irregular lump would likely prompt a more immediate biopsy. By carefully observing and documenting the characteristics of any breast lump you discover, you are providing your healthcare team with invaluable information. This informed approach helps facilitate a more accurate and timely evaluation, leading to the right next steps and ultimately, greater peace of mind regarding your breast health.